Okay, so this is my video about my exposure and bond surgery. Okay, as you guys know, about 2 years ago, I had exposure and bond surgery because I had impacted canine teeth, which are also known as your vampire teeth, you know, the sharp ones that are there and there. Okay, so it took a year and a half for my teeth to get in the right place, which is okay. It's not that long. I've heard stories where some people had to wait like 3 years, or their impacted teeth came down and they came in crooked or reversed, so it made the whole process of having braces even longer. Okay, so I just wanted to let you guys know how long it took. They tighten them every month for a year and a half, so 18 tightenings of these. Okay, the one problem I've had with it is the exposure and bond surgery. I'm about to show you. It's kind of gross, but it might happen to you. When you get exposure and bond surgery, they cut the gums, right? Because my canine teeth were right under my nose, or my vampire teeth, whatever you call them, were literally right under my nose. It didn't make my lip protrude or anything, but they were right there. So they cut your gum open, like you get a flap, and they bond a chain onto your tooth that's inside there, and every month you go to the orthodontist and he tightens it. But in doing that, they also tell you you're at a risk for having it's really rough on your gums. I mean, you have to floss and use your water pick all the time when you have that kind of surgery, because the mouth is really easily infected. You're always eating food, putting stuff in your mouth, you know what I mean? But so the reason I still have my braces on right now is because they are waiting. Do you see them? Okay. So they are tightening them still and everything every month, but they look good. But it's really hard because during this whole process, sorry, my nose rings all weird. During this process, I kept getting gum infections just up here above my front 6 teeth or whatever. You get what I mean? There's not 6 in the ones right here, because of the gum surgery. So my gums still look really bad. They put me on antibiotics for them every month, and these special mouthwashes and toothpaste. They say it has nothing to do with how I'm brushing my teeth. It's just the gum skin there was so sensitive. So I'm going to show you what it looks like. It's kind of gross. I'll show you both sides. So that's where they did it on that side. Do you see how right there this gum skin looks different? Yeah, so that's where this is this impacted tooth. This is the impacted tooth that came down from way up here. That's what the skin looks like now. I'm sorry, you're inside of my mouth. And then the other side is the side that looks worse. Do you see it? All that up there was where the chain was at. This side is harder for me to show you guys. See where it's really puffy and swollen? And when this tooth came down, they have to file it really good, because when it came down, it had a little extra particle on it, which they say happens. But this is what this side looks like. Here's the other vampire teeth, or the canine. So here's how my teeth look. They're just working on my bite now. Do you see how my bite's off center? Watch. See, when your teeth, I know I'm making an ugly face right now, are supposed to line up with your nose. So see, you take this part and you go directly down. You see how this is more to the left? So see how it's more to the left? And my other eye is more to the right. So they had to align your teeth so they look like that. Matching. Alright, but I just wanted to tell you about my exposure and bond surgery, show you what my teeth look like now, and how the impacted teeth have came into place. And there's this one again, and here's the other one. And about how the gums look. So that was my biggest struggle with it. But if you have any questions about my surgery, or how long it took, or anything to do with that, just ask.